Hi, my name is Dr. Bob Montes, and I'm here to tell you about NewBrain's method of examining the brain using state-of-the-art medical-grade quantitative EEG. EEG stands for electroencephalogram. What I'll do is I'll show you what we do when we're conducting a brain map and what sort of brain waves we're measuring, and then I'll take you through the process of what we do to actually change and heal the brain. Now at NewBrain, we know that there are a number of reasons behind difficulties with brain functions. A lot could happen in a given lifetime, but most people understand that what goes on in our brains will play out in behavioral symptoms that stem from an inability to regulate. When we find these common difficulties in the brain, we refer to them as our mental health issues, and that's most of what we deal with at NewBrain. We deal with issues like anxiety and depression, obsessive compulsive disorder, bipolar disorder. We even work with things like autism and ADHD. Now, to examine the brain, we go through a process. A cap is placed on the head containing sensors, and there's no pain or shock in this procedure. We simply are reading the brainwave activity on the computer using this amplifier right here that you see down next to the technician. Now, what you see on the screen are various brainwaves that all communicate at once. Now, we use a procedure called a fast Fourier technique to divide the brainwaves into its different categories. And then we measure the frequency of the brainwave and provide a name for each of these frequencies that have more of a personality to it. So if we were to start at the very bottom of looking at all of these brainwaves, you would see the delta wave, followed by the theta wave, the alpha, the beta wave, and then the more rare gamma wave. Let's start with the delta wave. So delta is our slowest brain wave, and it oscillates between, say, 0 and 3 hertz per second. Now, this oscillation that occurs at this pace is considered a very slow oscillation, and it is considered our sleep wave. So very similar to how when you look at like a single amount of unhomogenized milk, you're going to see perhaps one layer of it that's closer to whole milk, and then you might see a 2% amount of that milk, or 2% of the whole milk, or skim milk even, and cream. So those various layers all exist at once. So when you look at an active or live EEG, you're going to see the accumulation of all those waves at once. Now, this high amplitude delta wave, as you can see with this nice wavy sort of oscillation, is really more present in infants up to about 3 months to 1 year. They spend a great deal of their time in delta. And so this wave is important because it is part of what is referred to as the neurogenesis, or the creation of neural connections in the brain. The next brain wave is the theta wave. A theta wave is going to oscillate somewhere between 4 to 7.5 hertz per second. Now, the oscillation rate is consistent with what you find in REM sleep, or in times when the person is kind of hovering in that sort of semi-conscious state, like right before you wake up in the morning, or right before you go to bed. And so the theta wave is powerful because it learns in an uncritical fashion. So the importance of the theta brainwave is oftentimes underscored by its use in hypnotherapy. So we do hypnotherapy here at NewBrain, but our purposes right now is to explain that the nature of the theta wave is to allow for the brain to be in this very calm subconscious state. It is also related to our dream state, and so you'll often see it associated with REM sleep as well. Now, the alpha wave is an interesting brain wave. Really, it's the king of brain waves. And alpha is really, as you look at a raw EEG display, will be the most obvious. It has very high amplitudes. It's often very rhythmic. And it was really one of the first brain waves to be discovered years ago by Berger. Now, interestingly, alpha is really the first conscious brain wave in the whole array of brainwave patterns as you're waking up out of sleep from delta to theta and then to alpha. And we often refer to this wave as the bridge that links all of the unconscious brain waves of theta and delta to the active thinking brain waves that you get from beta and gamma. Now, alpha is about an 8 to 12 hertz brainwave pattern. A relaxed and focused space is what it really involves. And it's responsible a lot of times for what we refer to as the state of flow. So when you're in the zone or when you're in a deep creative way, perhaps you're watching TV or you're driving in your car, you're pretty much doing a mindless activity. And so the brainwave of alpha is the most consistent during those times. When we close our eyes, we signal to our body that we can relax and safely fall asleep. So when we close our eyes in a normal response during an EEG, we'll see an increase in beta of 50% or more, especially in the back of the head. Now, the speed of your alpha brainwaves is what is referred to as our dominant or peak frequencies. So it's like the shutter speed of a camera. So the faster your alpha peak frequency, the faster you are at processing data, and the more data you can, the more you can take in. So IQ is often measured with this. And one of the beautiful benefits of the treatment that we provide is we can help with that shutter speed and improve alpha peak frequencies, which then therefore improves learning. Now the beta waves. Beta brain waves really cover a large spectrum. It goes from about 12 hertz all the way up to about 38 hertz. For the purposes of what we do here in our mapping system, we go up to 30 hertz. Now, beta encompasses all forms of action, thinking, and problem solving. And it could be anything from like the mundane of creating grocery lists to really complex things like computing mathematical equations or something like that. Now, beta is broken into several categories. The lower beta frequencies are somewhere between 12 and 15 hertz, and it's the calmest of all of our beta brain waves, and it's often coupled with stillness and presence and relaxation, high concentration. Beta 2 is another span of brain waves that range from 15 hertz or 15 oscillations per second all the way to 23 hertz. And this is where we undertake tasks, involving detail or processing with meaningful comprehension. When you get to the higher frequencies, like between 23, 24, 25, up to 30 hertz, it shows states of high focus and engagement. So this state can also be indicative of anxiety and stress for a lot of people. So this is an area that when the amplitude of that frequency is high, then you'll see lots of anxiety coming from the person. Now, if alpha, as I mentioned earlier, is the king of all brain waves, gamma is considered the guru. Now, gamma brain waves are about 30 plus hertz, and they've been associated with states of inspiration, hyper-alertness, perception, even enlightenment. In fact, recent studies involving practice meditators have shown gamma synchrony as a common finding in levels of heightened meditation and awareness. Gamma has been classically difficult to capture since it's very fast and low in amplitude. It can be easily confused with muscle artifact from scalp tension in EEG, and it's for that reason currently a difficult brainwave to train via neurotherapy. Nevertheless, We include that in this list of frequencies to allow us to better understand the nature of brainwave function. Now, before we go any further, I want to explain what the normal distribution for brainwave functions are. Now, we use a color scheme in our brain mapping to identify low amplitude versus high amplitude frequencies. So imagine that what we're doing at this point is we're looking at colors to indicate whether our the amplitude of our frequencies are low or high. And you'll see in my illustration using flat maps why this is important. But for now, just understand that this area in the middle, which is colored black, would be the equivalent of having normal frequencies in the brain. And generally speaking, we want our brain waves to be closer to the 0 point or the midpoint of that bell-shaped curve. Now, when it exceeds that midpoint of the bell-shaped curve, the frequencies then become either higher in amplitude or lower in amplitude than what we want, and it creates dysregulation in the brain. Be aware that the color scheme is really not that important, but for the purposes of our maps, black in the middle here is considered the best frequencies or the best amplitude to get from our frequencies. Another thing to keep in mind as well is that when you look at the maps that I will be showing you, you'll also notice that there'll be the various frequencies of delta, theta, alpha, beta, and high beta. So we'll be examining that much more closely as we go along. When I speak of amplitude, we're really speaking of the height of the brainwave. And when you look at brainwave patterns, frequencies that are of what we refer to as a normal amplitude will look somewhat like this. When we go deeper and look at other levels of frequencies, we might find the amplitude increasing and perhaps getting too high. But most of the times we'll see these high frequencies really dominate the pattern. So you'll see these up and down movements occur within the brain map that will be higher than the framework that's supplied here. So there's a grid, as you can see in there, very hard to see, but there's a white grid line that's in there, and those brain waves are kind of staying on those to help us better examine what we're after. This is a sample of low frequency. So here's a normal frequency, and this is what we refer to as low amplitude, or what we call this sometimes flatlining. And when people have a lower amplitude in their frequencies, it's coupled with problems that occur in relation to that. So because this is very confusing data for the average person to understand, the next step is that we take all of the data, pull it together, and we put it into what is called a flat map. Now, to understand the flat map, you must first look at this row here at the top called absolute power. You will see that each of these figures has a nose at the top and the ear, the left and right ear, on its side, indicating that we're getting a top-down view of the flat map. So the EEG data on the previous page is then converted to a form that can be compared to what we call typical or normal EEG. Now, the reason for the different test conditions is that the results allow us to analyze how the brain performs with increasing and varied demands. When we analyze this data, we're looking at several EEG factors, including EEG brainwave size or magnitude and EEG brainwave frequency and coordination or connectivity between the brain. The information from this analysis is then used to develop a neurotherapy treatment protocol unique to the individual. This particular map is identifying alpha waves that are showing high amplitude slightly in the left frontal region, then across the temporal region, and then across the occipital area of the brain. So here's front, here's temporal, and then here is occipital and parietal, the back of the brain. And this amplitude is considered high, and the colors indicate that these are up to 3 standard deviations above what is normal. So if we were to go back to the brain map, to the normal distribution, the map that I showed you, the flat map that I just showed you, is showing amplitude over here in this area. So it can be as high as 3 to 4 standard deviations above what we consider normal. So it would take some work to improve that. So how would we repair and strengthen the brain? Well, this is the second part of the presentation. And so I will show you the tools that are provided for guiding the brain toward brain change. Let's begin with this concept of neuroplasticity. When we say the brain is plastic, it's the ability of the neural networks in the brain to change through growth and reorganization. So these changes range from individual neurons making new connections to systematic adjustments like cortical remapping. When we introduce neurofeedback, neurofeedback is a tool that takes advantage of the brain's ability for neuroplasticity and neurogenesis. So we can literally change unhealthy neuropathways in the brain to more functional and healthy neuropathways using a combination of operant conditioning and feedback. So the brain changes in 3 basic steps. There's a personal effort through concentration and relaxation when you are engaging in the activities provided by neurofeedback. We also need very clear and accurate real-time feedback in order for the change in the brain to occur consistently. And finally, we need something visible or auditory to reward us in order to know for sure that we are making the proper changes as we are attempting these steps. So how does it work? Well, everybody's heard of classical conditioning. Everybody knows about Pavlov's dogs, and that what occurs is respondent behaviors, which are those behaviors that occur automatically or reflexively, such as, pulling back your hand from a hot stove or jerking your leg when the doctor taps on your knee. You don't have to learn these behaviors. These are respondent behaviors because they simply occur automatically and voluntarily. So this drawing right here is like the basic classical conditioning of the Pavlovian model in a nutshell. Classical conditioning just occurs when you pair a natural stimulus, an unconditioned stimulus. That is to say that we are responding without any need or effort on our own part. It's an automatic response. And it's paired with an outside stimulus called a conditioned stimulus, like a bell or a tone. And then with the pairing of these two over time, then you'll elicit the conditioned stimulus. When we use neurofeedback, we are actually using a different type of conditioning called operant conditioning. So I took the time to explain the normal Pavlovian conditioning, but what we do in neurofeedback is what most people forget about, and it's this other method called operant conditioning. Operant behaviors, different from respondent behaviors, are those that are under our conscious control. Now, some may occur spontaneously and others purposefully, but it is the consequences of these actions that then influence whether or not they occur again and again in the future. So our actions on the environment and the consequences of the actions make up an important part of the learning process. So if you look at this particular picture of this mouse or rat in this box called a Skinner box, this rat will press the lever and receive a reward. Over time, the rat is taught to press the lever during certain conditions. For example, if the light is red, the rat is not to press the lever, or he may receive a shock under him. If the light is blue, that may indicate that the rat can press the lever in order to receive a reward. There's also sounds involved in this Skinner box. So the whole point of this is that the rat is learning through discrimination how to get a reward. And that's what we're doing with neurofeedback. And in this process of the individual getting a reward that's on the screen during the process of changing their EEG, we are then shaping behavior, accomplished basically through what we refer to as successive approximations. So imagine that if we're teaching this dolphin how to jump through a hoop, we first start by lowering the threshold that's needed for them to get a reward. So when the hoop is in the water at the beginning, the dolphin will swim through and receive a fish. But little by little, the hoop is raised higher and higher in the water, and the dolphin is now able to jump through the hoop to receive its reward of fish. However, if the dolphin were to swim after this point through a hoop that happened to be underwater while it just happened to be there, then the dolphin would not receive a reward. It only receives a reward when it's successively accomplished what we want it to. And this is basically raising the bar. This is exactly what we do with neurofeedback, except we provide continuous reinforcement and we don't provide a punishment of any type. We just simply don't reward the behavior that we no longer want to see. So we deliver reinforcement for what exactly we want it to do. And then we raise the bar for the individual to do better and better along the way. Now, similar to the EEG that your individual was given at the beginning, where we map the brain, we provide the same map for the individual and place this on their scalp, and they can then watch in real time while they receive rewards for what their brain is doing. Now, notice that the shaping process occurs with the individual attached to sensors that then send the signal into the amplifier right here, then into the computer, which then emits a signal from the screen in front of the individual. The client just sits in the chair near the TV monitor while they're hooked up to these devices. And just like the rat in the Skinner box or the dolphin in the photo, the individual is rewarded a small bit at a time until they achieve success. Now, before going too much further, I want to indicate that neurofeedback is not the same in every situation. What you see here on the screen are various devices that are referred to as neurofeedback. And this is a lot of cool equipment that I actually own myself. They're very helpful for doing it in the off times. But a lot of these are meant to aid in smaller attempts of brain change, such as alpha theta training, using binaural beats. Perhaps you might get a mild, gentle stimulation. There can be also low infrared lights. So these are versions of neurofeedback because they are tools that qualify as giving feedback or information to the individual in order for them to make some sort of change. Now, this is another form of neurofeedback that I also used in my program. It's called a two-channel system. And it's used today by many chiropractors, massage therapists, other counselors. There is not a lot of training required to use this equipment, but in general, people do say they feel better. However, after using it for several years, I did not feel I got the results I wanted. And so I began a different procedure altogether. But again, this is also referred to as neurofeedback. Here's a picture of a two-channel neurofeedback system where the person is wearing entrainment glasses and the leads are placed in one of the most common areas, which is the frontal lobe. But I've always wondered and was wondering at that time, what would you do for more global injuries? For example, with concussive injuries or when entire networks of the brain are globally affected. As neurologists know that when trauma happens to the brain will seek to repair itself, and in the process, it starts to recruit other areas of the brain to compensate. But unfortunately, the use of the 2 or even a 4-channel system is inadequate to the task. There's just too much area to cover. Here's an example of an individual that suffered a trauma to the brain. Notice that in the delta region and in the theta region, we're seeing global damage to the brain, so that the EEG is now amplified to such an extent that the entire brain is being overworked with high amplitude delta and theta waves. Now, this is the effort of the brain to heal itself, but oftentimes just this process alone can take a long time for a 2 or 4 channel system to work. You're constantly moving the leads. When we use our system at NewBrain, we use the NeuroGuide software to do the job, which is the use of the entire cap at once. We use the best program to train the entire brain at one time. Now, this equipment is used in 70 universities, 3 Ivy League universities and multiple medical universities as well. NewBrain is also found in, the NewBrain equipment, I should say, is also found in 71 hospitals and medical centers throughout the world. And this equipment is also found on 14 United States military bases, which use this equipment primarily for some of the most devastating disorders like PTSD and major depressive disorder. Now, NewBrain uses the best and most comprehensive treatment modality on the market today, and now has wonderful illustrations of how the brain is actually functioning. Now, these are live feeds of the brain that we have with our equipment. So we get the best chance of improvement when we're identifying the entire area of the brain and we're able to treat it once. Now, how did this equipment come to this point where we now have such advanced equipment using what we refer to as a simple procedure of EEG? Well, years ago, in 2013, somewhere through 2014 and 15, the BRAIN Initiative began. In the Obama administration, he gathered all of the research that existed out there and comprised or compiled all of the information to a comprehensive data pool on the most comprehensive data pool on the planet, where it pinpointed brain regions and networks. It looked at blood flow, metabolic channels. It looked at some of the neuronal structures and chemical flow. So NewBrain actually contains the information in databases that were gathered in this massive analysis of the brain. So the BRAIN Initiative was led by the National Institute of Health, and it gathered all of this information and matched MRIs and SPECT scans and PET scans and DTIs and EEG to gain the best advantage of what was going on in the brain. Now, here's the beauty of all of this. The equipment that gathered a lot of this, including EEG, was matched, and it was all brought together under qEEG. In other words, you can do a qEEG and get the same data or very, very close data, similar data to what you see in all of the equipments that include the SPECT scans, MRIs, and the DTIs, et cetera. So not to belabor the point, but the reason this was done and useful for qEEG is because when you get one of those maps from one of these high-tech equipment, pieces of equipment, you are actually spending $3,000 to $4,000 just to see it, just to have it done. When you use qEEG, you get a large amount of that same database pool, and it's pulled into EEG for $395. So imagine the savings that takes place. In this particular research article, it reads, MIT research proves you can control your brain waves to boost attention. Subjects in the study simply needed to be given live feedback of their brain activity in order to control their brain waves. Let's take a quick look at some brain-related conditions that include things like anxiety, depression, sleep disorders, PTSD, and other conditions. So there's many reasons why symptoms pair up. And part of our work in qEEG brain mapping and subcortical analysis is to determine where and why and how the various pathologies emerge. Let's begin here with anxiety and stress. Now, the location of excessive beta brainwaves will help us understand the nature of stress, whether it be this, persistent feeling that a person has that something's not right. Maybe you have constant nagging thoughts of negativity or worry, fear, dread, whatever it is, be it restlessness, we're able to identify it by certain patterns on the brain map. Here's an example of anxiety and stress caused by high levels of frontal beta. Notice the colors in the front here. The background color for this particular slide is white, so that would be considered the normal brainwave patterns. But notice how the front of the brain contains these high amplitude frequencies in beta. This is often found among people who are struggling with excessive thinking or repetitive thoughts, things of that nature. Another anxiety and stress profile is called occipital beta. Notice that the beta waves are high in amplitude in the back of the brain in high beta. When this is occurring, there's kind of this general feeling of unease or just mild stress. Now, there are different depressive conditions. These could be caused by early life trauma. It could be caused by dopamine and serotonin neurotransmitters that are at a deficit. But whatever the reason, we can determine how that depression tends to show up in a brain map. This is one common depressive condition on a flat map where we see that it shows up in the region that's at the left frontal part of the brain. So generally speaking, when you see something like this in the profile, it relates to difficulties with depression. Another condition of depression would be the high amplitude frontal data. So in the injury that I showed you earlier of the concussive event, where it was a global concussive event, the individual was also complaining of depression. So high delta, high theta, those are commonly seen with depressive conditions. Another depressive condition is what we call alpha asymmetry. So typically the brain, the left hemisphere activates and therefore it depresses alpha electrical activity as seen on an EEG. So with happy thoughts and the right hemisphere activating a little bit more, it will suppress the alpha. And then with negative thoughts, you'll see it on the other side. So what you'll see here is considered a normal happy brain. It's low amplitude on the left side of the brain and high amplitude on the right. At the moment that depression begins to occur, you have this event called alpha asymmetry, and that means it's switching sides so that the left side is moving up in amplitude and the right side is lowering. Another sign of depression, and we can detect this using our system. We can also locate the general region for sleep disorders, which are usually characterized by a deficiency in the slower brain waves. So you see over here the blue and greenish color here in delta and theta, and this is often a reflection of not enough amplitude in those delta waves to create a person's sleep patterns. We can also work with addictive disorders. Now, the addictive brain is not necessarily due to a lack of discipline, but we do find that brain training works to normalize what is dysfunctional in the brain. And that's because we're identifying the reward network in the brain. So this usually includes the amygdala and hippocampus. And one of the benefits of our program is those sensors that are placed on the top of the scalp when we're working with people, those particular sensors are not necessarily called scalp sensors. They're like cell phone towers, and the signals are triangulated to identify the deeper parts of the brain. So this sensor will coordinate with a sensor here and a sensor on the other side to read that deep part of the brain that we often that we can't read if we're just using the 2 or the 4 sensors on the scalp. So the beauty of our system is that we're able to go to the deep parts of the brain. Here's a sample of addictive disorders where the lower frequencies, the delta and the theta waves, are showing some difficulties in that frontal area. So we often use what we call a stimulation therapy in those very deep areas that are showing those spots. So we'll lay something very gently right here, and then we'll teach that part of the brain to stop functioning in its addictive manner. We're able to decrease cravings for alcohol, nicotine, food. We're able to reduce cocaine cravings. We're able to help in individuals making risky choices just by treating that area of the brain consistently. One of my favorite pictures, but this is how we work with ADHD. Now, we know that regardless of whether a patient demonstrates symptoms of hyperactivity or, the inattentive type of ADHD, we're able to get in there and help with providing the individual a greater level of attentiveness and strengthening the executive function in the brain. So ADD has a number of variants. In some cases, the variant has to do with just how you have maybe a high beta or a fast beta going on. You can see that across the top in the actual record. So this is like someone who can hear multiple conversations in the room at once and has difficulty focusing and concentrating. The most typical profile is alpha slowing. This profile identifies the slower rates of alpha than others his or her age. So this is called having a high theta beta ratio here. Another variant of ADHD is called hypoxia, and this is often related to birth complications when a lack of oxygen has come to the brain, and so the attentiveness falters. And finally, another variant to ADHD is central theta, and you'll see sort of a high central area of theta. And this presentation usually has to do with the need to downtrain theta at a specific site to encourage the brain to speed up processing there. So remember that slower frequencies that have high amplitude is slowing the brain down. But when the brain has a slow frequency, bluish colors all in it, then it's not housing enough of calming waves to provide the attention needed. So there's always the double variant that we're dealing with. And this is the final one. It's a variant that has to do with alpha peak frequencies. When alpha is really high and showing high peak frequencies, then the shutter speed of that camera is opening and closing really fast, and so they can really absorb information quickly. But this individual is, in terms of when he or she is a child in school, might be very bright, but end up doing very poorly in school because they're digesting data at a faster rate than they're even able to receive it. So they end up becoming bored with school. And you may know people that were like this. Now, we also help with autism. And what we're looking at here is what is called the mu variant in an eyes open EEG. So autism presents in this way. And this is where the mirror neurons, this is sort of an indication when the mu rhythm is off, that the mirror neurons are becoming disengaged. It happens in the central region of the brain where there's lack of synchronicity going on in the brain. And then it ends up meaning essentially that the individual has difficulty with social interactions and social functions. Here's a sample of those mirror neurons activated and the mu rhythm showing some problems. And a few months later, after steady treatment, the individual is showing a lower amount of that in that region of the brain. So it's nice to see that we can help this subjects with this issue. I'm going to read this. This says TBI and concussive syndrome. In cases of TBI, neurofeedback is probably better than any medication or supplement. It comes from Richard Brown, who's the Associate Clinical Professor of Psychiatry at Columbia College of Physicians and Surgeons in New York. So we understand at this point that when there is a concussive injury, inflammation occurs. And if the inflammation was not able to properly heal in the brain, which is the function of neuroinflammation, then the brain will ultimately learn to handle the inflammation by altering cellular structures to form tougher tissues and new neuronal bonds, which would then consequently prevent, blood perfusion at the sites of the injury. And then it prevents the slower brain waves of delta and theta from being read from the surface. So as a result, it dulls the amplitude of the faster waves as well. So what we're doing with training in this area is we're improving blood flow and healing and reducing inflammation by that process. This is also a process that's helpful when we're healing brains or helping to heal the brain of traumatic brain injuries and CTE. Frontal, you can see the traumatic brain injury here in the frontal area where the concussion or stroke or TBI took place. And here's another sample of an injury to the brain where the individual was traumatized in a car accident, and you see the theta waves really shooting up really high. So the first thing that happens in the brain is it seeks to heal it with the slower wave frequencies. But if nothing is done to help the brain, then the individual has greater and greater struggles in that area being useful to them in the future. So we do want to be careful with concussive symptoms and TBIs. We want to help to increase blood perfusion in that area. It will release greater amounts of calcium, and it will bring fresh oxygen to the area of these damaged parts of the brain, and of course, provide the brain a greater opportunity to heal itself. And for the final part of this presentation, I'm going to talk just for a minute on another aspect of neurofeedback, or rather of NewBrain, which includes what we refer to as our Stim Training protocol. So the use of neurostimulation and neurofeedback together can create really profound shifts in the ability of the brain to recuperate and recover from any type of injury. And these injuries, of course, do not have to be concussive or TBI injuries. They can be depression, anxiety, they could be stress-related conditions, as I've mentioned already. Now, the studies have shown that neurostimulation can increase blood flow, perfusion, it can help release calcium and also restore things almost immediately. So we want to be able to oftentimes use our very gentle stim training techniques to help our individuals. So neuromodulation at the clinical level is really comprised of the transcranial alternating current stimulation, or we use direct current stimulation. We also use things like random noise, and we also use the pulsed electromagnetic field stimulation, or PEMF. Now, to identify to indicate just really how safe this is, many children are using these same stimulation techniques, very gentle and very safe. There's been research done on stim training by the Department of the military, the U.S. military department, or DARPA, and they've conducted research to identify some of the ways that you can use stim to support the brain for improvement. This would include a method for accelerated learning. There's also placement of these stimulation on places to reduce addictive cravings, as you can see here. We can even enhance mathematical abilities using this particular montage. You can use Stim Training to improve memory, Stim to improve attention and working memory, and you can also even help chronic pain. All of these are research locations for the brain, and they can help in pain caused by phantom injuries, fibromyalgia, low back pain, cerebral palsy, etc. So it's really a wonderful treatment. It's a very gentle and safe treatment, all approved by the FDA. So thank you for watching this video of NewBrain. I am a psychologist and board certified in neurofeedback, and I'm promoting NewBrain for individuals to be able to go ahead and get the help that they need. Now, the other company is called Trinity Psychology and Wellness. We do psychology, naturopathic wellness, counseling, psychological evaluations. And what we do is we provide a holistic type of treatment, one that involves, as I mentioned, the wellness part, which is making sure that the body is doing well, and then NewBrain to help the brain do well, and then psychology in its various forms to help individuals improve and function better. Thank you for your time.